Okay, so we are now recording, and I have Dr. Kafka with Unity Point St. Luke's with us, and Dr. Warrington from Mercy One, Siouxland, and I'm Tyler Brock with Siouxland District Health Department. We appreciate anybody who's listening or watching this. You guys, the reason why I brought you in this afternoon was because one of the things that we've been hearing is that people, obviously COVID cases are increasing. That's something that everybody knows. COVID cases are increasing. We've been seeing that now for the last few weeks. Certainly they're seeing it in other parts of the country, even worse than we are. So, I don't know if we're heading in that direction or if we'll be able to hold that off or not. I don't know. But one of the things it feels, and again, some of this is opinion, but it feels to me like this virus has been very tricky to prevent. In public health, we're so focused on prevention. We really, we talk all the time. It's a lot cheaper to prevent something than it is to treat something, and that kind of a thing. And as trying as best we can with this, it seems to elude us. And some people just seem like there are going to be infections that are going to happen. And so one of the things that has come to our attention, and it really isn't new, it's something that's happened from the beginning, is this notion that, yes, we want to prevent every infection we can, but we also need to try to make sure and limit the seriousness of some of these infections. Minor infections are minor infections, and we get over those and that kind of a thing. But the serious infections are really one of the things that we're trying to prevent at this time. And over again, here in public health, we've heard from the medical community, by the time people get to the hospital, they're already too sick. That if we would have just gotten them here a couple days earlier, we might have kept this infection from going from being relatively minor to now of a sudden being more serious. I mean, is that something you guys are seeing? Is that something that you feel is an issue? What are your thoughts on, this notion that people are coming to seeking medical care too late? Anybody can jump in.
You want to go first, Dr. Kafka?
Sure. Yeah, we experienced that with the first surge that we had back, April, May of 2020. Didn't seem to be quite as big an issue in the fall when we had our second surge. The things that we have seen is that we've had people that have gone and been tested somewhere, and then 5 to 6, 7 days later, they're suddenly showing back up at the hospital. Okay. And their disease has progressed. Mm-hmm. So we've kind of see that course, and the folks that we do have coming in seem to be younger. Obviously, a majority are not vaccinated, and some of our most sick people are coming actually from outside hospitals, the neighboring critical access hospitals. They've got people that are sick at an intensive care level of, requiring that kind of level, and then transferring them in. So we're seeing a group that's coming in, not necessarily originating within Sioux City, which is sort of exciting. Okay. But it's there. There's that group, and then there's the other one that in this it's kind of that middle-aged group, or younger group. The 40, 50-year-old people. They seem, they got symptoms. They've been tested, and then suddenly you get that, a week later, and things kind of are firing off. So. What we're trying, I know that one of the things that we're encouraging our ED docs to do, and the primary care docs in our system, is that if you do get somebody coming in with early COVID, and if they at all have any sort of comorbidities or things like that, to see if they qualify for the Regeneron, the monoclonal stuff, because we do have that available. And we're seeing more and more of that being used now, as we've kind of put the reminder out there for these people, that the symptomatic folks coming in, to try to offer that to them. And we're hoping that may stave off a second wave, or that, a week later, where the disease worsens. So, Dr.
Warrington, what about your thoughts on that?
So, I think that you kind of hinted a point that, as an ER doctor, I've joked, in tongue-in-cheek manner for all my career, is that you'll almost never hear an ER doc say, you came at precisely the right time, because it's so hard. You don't know, are you too sick, or are you not sick enough? And so I tell everyone, especially the ones that I let go home, I say, if there's anything that's new or worse or just concerning, that's why I'm here. My definition, and I'm sure Dr. Kafka shares this, our definition of an emergency is very, very different than most people's at this point in our career. And so, we see this realm where, yeah, you see some early cases, which is good. Like Dr. Kafka said, we now have some therapies that hopefully this can tweak your course a little bit and shift you into that right direction, which is fantastic. Unfortunately, we see a lot of people too that just, try and push it out. And what I'd say is probably even more concerning, and I know this is kind of tangential, we're seeing more people with other things going on that try and wait too late. So I'll give you a great example. Chest pain, who just try and push it out and think, no, I don't want to go into the hospital because of COVID. I don't want to go into the hospital because I don't want to be another burden. I don't want to go into the hospital because of X, Y, or Z. And they push it 2, 3, 4 days from something that we could have had you into the cath lab and got this fixed up right away to now you're going to have heart failure the rest of your life. So, I would really.
So it's not something uniquely COVID related necessarily.
No, but we're seeing a lot more of it now, I would say, where, the people with chest pain, belly pain, you name it, that they think it's going to go away in a couple of days and they just keep pushing it. Whereas before COVID, we were probably seeing them right away.
So I'm going to ask you a little bit what you think is maybe behind that a little bit, because I think it relates to our COVID discussion. One of the things that I know, and we have to kind of own a little bit, especially in public health, when COVID first started, we were in public health, we were so concerned, and I think rightly so, about the hospitals getting bombarded, with the worried well. The people who really don't need hospital care, but it's a new virus, they think they're going to die, so they go to the hospital. And we were really trying to, I'll be honest, we kind of downplayed that. We're like, most people can manage this themselves, for the most part, the vast majority of people don't need hospital care. And now I'm starting to, as I've heard this from docs and other providers and things like that about people showing up too late, I'm like, God, did we do too good of a job with trying to keep people out of the hospitals and kind of getting that message across? I'm here to tell you, when we did it, again, it didn't happen so much in that, like Dr. Kafka said, in that fall outbreak that we had, but it was more in the early stages where when we were doing contact tracing, we were talking to people who were pretty sick, and they were like, and they asked us, is it okay for me to go to the doctor? Is it okay for me to go to the hospital? And we were like, oh my gosh, have we convinced people that they can't seek, that they can't seek medical help? And so it really kind of turned a light on for us. I think that, did we maybe overdo it with trying to keep the hospitals from getting rocked with all these patients that now people are staying home? What are your thoughts on that?
I think there's a mixture of a number of things. I think from a public health perspective, and really from a news and international perspective, we were being bombarded by this, everywhere we go. You look at, Times Persons of the Year, you look at the heroes, you look at really from every avenue, people were getting this, hospitals are going to be overwhelmed. And add on top of that, the fear that if you do go into the hospital and you didn't have it, well, you're at risk of catching it. Mm-hmm. And so I think there's a number of those things that we're all playing into a factor of it. And, you tie into that when people recognize the grand scale of what's going on, they also really, what I've recognized at least, don't want to be a burden. And so I'll have people come in and when they're finishing up and they get to go home, if they're doing well, they'll say, oh, I'm sorry I came in. No, don't be sorry. I'd rather see you and this was a good outcome. Right. Just as often we have people that come in that, if we'd let them go, they'd be apologizing too, but they're not well enough to go home. So I think there's a lot of factors at play. I think it's really tough to say. There's always the Monday morning retrospective quarterback that looks back and maybe we could have done something different. But, I think people have been doing their best, and I think that's all we can do.
Mm-hmm. And I think what we have been seeing and has concerned us is that our overall hospital sense, I think as we discussed before, last year people stayed away. So when the hospitals filled up with COVID, we were not faced with just taking care of other folks that would normally be in the hospital with normal illnesses and whatnot. I think we're now seeing the effects of that delay in people having been seen over the last 12 months, because our ER business has picked up recently back to where almost 2019 levels that we had. And those people, when they're coming in, they're really sick and needing to be admitted. And so our critical, care admissions coming out of the ED, it's not, they're the COVID group. And unfortunately, we're just single digits for that in our own, here at our own facility. But by and large, it's just normal, general med surgical kinds of, conditions that are bringing people here now. And so that's what's really stressing, our staffs and our just resources, just because we've got a full house with non-COVID patients and struggling just to be able to staff folks and have enough nursing folks with good ratios and things like that to keep everybody safe. But I think we're seeing the results of people neglecting or holding off as long as they could, before the stuff is actually turning into real serious issues.
Yeah, lots of ripple effects to this whole thing. It's just such a disruptive force, regardless of, whatever anybody's views of what should have happened and could have happened and what we could have prevented and whatnot. Just an incredibly disruptive force in the whole bit. So with, Dr. Kafka mentioned it a couple of minutes ago, but what are some ways, how have we gotten better at treating COVID? You guys know a heck of a lot more now than you did, 18 months ago, right? And, and yet we still, when we talk to people on the phone, they still are very rarely aware of some things that might be available to them that could help them in their course of illness. So what are some things? How have we gotten better at treating people who've got COVID over these last, 15, 16 months or whatever it's been?
Oh, I think we've come up with a pretty unique combination of kind of drug cocktail that everybody kind of pretty routinely gets. Things from giving people steroids, remdesivir, using the immunosuppressant drugs like tocilizumab, keeping people off ventilators. I think originally back the thinking was that the quicker you got people onto a vent, they might be able to survive COVID better. We found out that you put people on vents, they just can't come off the vents because they're on long enough, they get so deconditioned and they sustain so much lung damage that it's really difficult. So there's other ways to do non-invasive kind of ventilation that we've done. We got very good at doing that kind of stuff. So it's a fairly routine. There's convalescent plasma, all sorts of different drugs that are used and seem to be fairly effective for those that is going to help it. So it's less a question of like how best to do it, but like I say, try to catch people early enough to get them on those meds and not to delay if they've got suddenly, they've been sick or been diagnosed and they're out 5-6 days and they suddenly are starting to have more shortness of breath. That's time to come in and have, get checked, see what their O2.
That was exactly what I was going to ask Dr. Warrington next. What are some triggers? Again, you're the ER guy. They never show up when they always come in too late. But what are some things that people could be looking for that, maybe this is something that I shouldn't just wait out, or maybe I should, look into this. Is there anything that jumps out to you that should be kind of an early warning sign or anything like that?
Yeah. So, it's hard because I'll say this. I'd say the quickest answer to your question would be twofold. I think that things that people can easily watch for is if you are having trouble speaking a full sentence without catching your breath. I think that that's something that you don't need to have your finger pulse ox on. You don't need a number. If you normally are just having a conversation like us and now all of a sudden you notice yourself, or maybe your spouse or your child or your friend or your neighbor goes, "You okay?" Because you're starting to have to take a breath in the middle of what you're saying, that's probably a sign you should be coming on in. And, again, it's hard because from my standpoint, I get lucky. You come in and I get to have all the fancy numbers and all the gadgets and gizmos to help me figure it out. You guys it's a hard job being at home, being a family member or caregiver at home and not having those types of things. So that's one of the big things. The other big thing that I would say that I've noticed, or that may give you a tip off it's time to come in, is if you're normally, able to get up, get around your house, maybe walk out to the mailbox without too much issue, and all of a sudden you catch yourself, walking to the bathroom and having to kind of put your hand onto the wall, or saying, nah, I'm gonna put off going to that mailbox until tomorrow. I feel like I'm just little bit too much work. Those are probably some of the easiest warning signs to just keep in the back of your mind. If you happen to have one of those cheap finger pulse ox monitors you can get off Amazon or at Walmart, great. Look for the numbers. If you don't have any problems with your lungs and you're healthy and you're starting to get down into that, 91%, 92%, somewhere around there, you probably need to be coming on in and getting checked out. But again, most people aren't going to have them, and that's what I'd recommend.
So what are some things, we get a lot of questions about this because you guys see the sick people. We're the ones talking to most of the well ones, most of the people that have minor illnesses, for every, 1,000 people that have ended up in the hospital, we've got 14,000 that didn't, and we end up, we talk to them a lot. A lot of them would ask us, is there anything I can do at home to help, that can kind of help me, is it just general sick care, the same thing you do if you had any, really any viral type thing, or is there any way that, that they could manage this at home that has a good chance of helping? And maybe not. And maybe it is just general, hey, keep, drink fluids, blah, 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 that kind of stuff.
I think that my big point is if you are starting to feel those, I would definitely try and, in the beginning, we pushed full quarantine and all this other stuff. But if you're starting to feel those, I think that's one big notion, even though that's not necessarily going to help you feel better. If Dr. Kafka's seen anything, I'll defer to him, but I haven't seen anything out there that says that this is really a great way to help manage it at home to keep everything away. I encourage rotating ibuprofen and Tylenol if you're healthy. It'll keep the symptoms down. So it'll keep your fevers down. It'll keep your aches down. It'll make you not feel quite as miserable. Like you mentioned yourself, trying to keep from getting dehydrated is pretty key.
Yeah.
Oftentimes we try and give people some lung exercises to make sure they're still taking real deep breaths and not letting extra infection in. So even if you have COVID, you certainly don't want to get, an atypical pneumonia on top of your COVID and then be extra worse. So, some basic lung exercises, we call them incentive spirometry. Usually it's, 10 real deep breaths, as deep as you can go, and staying hydrated. And like I said, I encourage people every couple hours, just rotate off, jot it in a journal, ibuprofen, Tylenol. But there isn't really a ton of great stuff at home for home remedies unless Dr. Kafka has something he's aware of.
No, I think it's just the usual kind of things you do for, cold, influenza, cold, flu sort of stuff. So more symptomatic and like say, making sure you stay hydrated, sleep, as much you can, rest.
It's you guys both brought up the dehydration thing. It's anecdotal, but I had a close relative that had COVID, was awfully sick, really feeling rough. Finally got talked into just going. It was clear that she was dehydrated, and finally just went in, got a bag of fluid, and it felt like night and day difference. Just how she felt was night and day difference. It doesn't cure COVID, obviously, but it made a big difference in just her overall recovery. So I relate that to people when they're talking to us. Seems like especially older folks and things like that, maybe a little bit more susceptible to, those kinds of things. So anyway.
Yeah, it's easy to get behind the 8 ball on that. If you're feeling extra crummy, even just with some body aches and you don't want to get up, think about how often you might get up to get a fresh glass of water or a fresh cup of tea or something. And once you realize if you're laid up aching, you're not getting up and getting that extra cup, every half hour or so. Anecdotally, I've heard a couple patients say, vitamin C or they've increased vitamins, and in addition to extra hydration, extra vitamins, they've started feeling better. But yeah, nothing really that I can say has been shown.
And there's some anecdotal stuff. Vitamin D kind of helps too, I think. So those. And the other things, I know there not a lot of people realize this, but one of the symptoms you can get with COVID is you get diarrhea. and you can get real GI symptoms. And those folks in particular really need to make sure they stay on top of their fluid intake and, drinking some of those replenishment fluids. They have some electrolytes and things like that in it so that they don't get severely dehydrated.
Well, you guys, I won't keep you much longer. You guys have been generous with your time, and I really do appreciate you coming in and just talking to us about this. I mean, anything else any last words on this, I guess? I mean, I really kind of just, hope that people, when they listen to this, they get the picture that, yes, it's okay to go. Yes, it's okay to seek medical care. And, and I know, and maybe this is just something that I just thought of that's come up a few times. I mean, I think somebody mentioned about, getting it out to making sure that the primary care doctors and the providers, that they know, hey, there's things that we can, there's things that we can do to treat some folks early, so that if they don't show up at the hospital, but they show up at their doctor's office, we can get them directed and get them treated as well. So just final thoughts, I guess, on people seeking treatment, taking care of these folks so that we can keep these infections from being serious.
I think it's important for people to feel comfortable calling their docs, these video, type of medical visit, at least talk to someone, see if something rings for them, that there's something that sounds like you're heading in the wrong direction, and get you to come on in. So I think it's, don't hesitate to talk with your docs, very much so, your primary care docs. I just kind of lost it, but go ahead.
Yeah, no, my point would be kind of twofold. One is that, if you think something's wrong, that's when you go ahead and come, whether it's to the emergency department or to your doc. Don't try and judge off, well, so-and-so doesn't think it's an emergency, or so-and-so doesn't think this, that, the other thing. The other thing would be is, even if you've sought care, as Dr. Kafka mentioned, if you have something, the way I phrase it, if you have something new, something worse, or something that's just concerning you, come back. We would much rather be safe, help alleviate your concerns, recheck you out, than have something scary happen a week from now.
And don't forget about urgent cares. I mean, it isn't necessarily the ED that you need to go to. We've got some good urgent cares here in town. So they're taking folks in. They're really pretty efficient getting, they let you schedule ahead. And so you don't have to hang around for a long period of time in a waiting room and things like that. And they do get you in and out very quickly. So that's another way for, get somebody to take a quick look at you, listen to your chest, get some idea of where you're at, get some baseline in case things do get worse than but yeah, absolutely.
Well, again, you guys, I appreciate your insight. I know people appreciate hearing some of this, that we talked about today. Thank you very much. I really do appreciate it. Have a good rest of the day.